I work at Ascension Seton Medical Center in Austin. I've been there since July of 2022.
I sat down with my friend who is a nurse at a hospital here in Austin, Texas.
And I am a registered nurse on a intermediate care cardiac unit.
Texas is a right-to-work state, so unions are pretty hard to come by around here.
We're the largest unionized hospital in Texas, and I think we're the only inpatient hospital. There were 2 other hospitals in Kansas that went on strike with the ASMCA.
The nurses at my friend's hospital in Austin have connected with nurses in several other hospitals around the country to go on a strike against the conditions that exist in these places where they work.
Day to day, I communicating with all the different doctors and specialties and occupational and physical therapists and speech therapists and social work and case management and the family and pharmacy and lab and everything. And I get the most interaction with patients. I'm there all day, and I get them their breakfast, lunch, and dinner, and all their meds in between.
I was interested to learn more about what the nurses were fighting for, the conditions as they exist now, and the hospital's response to the nurses on strike. These were the questions that I brought to the conversation that I had with my friend.
So I originally picked nursing because I like being on my feet. I like being active. I know I didn't want to sit down. I really like interacting with people, and I guess I really value human interaction, and so I'm definitely getting a lot of that on the job. Literally on my first day of orientation, they started talking about unionizing. The hospital did. They made us stay late and give this whole weird anti-union talk. They were talking about how the union will take our benefits, and I didn't even know what benefits I had yet. They hadn't told anything, and they handed out all these papers. I forget what it said. That was the one. It said you have the freedom to vote yes and the right to vote no. Please vote no for the union or something like that. So it was weird. I didn't know what they were talking about. I'd not really had much exposure to unions or strikes or anything, but I definitely knew they were against whatever it was. I genuinely had no exposure. I mean, this is my first career, so I hadn't had exposure to this before. One of the nurses on our floor, she, I think was our floor rep. She no longer works here. She left, and she'd worked on our floor for 15 or 20 years, and she left with no word. She didn't say bye, anything. She just left. On our night shift, one of our charges, who has only worked on that floor, and she worked there for 20 or 25 years, she just left. With no job set up, just knew she couldn't work there anymore. One of our techs on nights, he's worked here for 25 years, and he left.
Wow.
Suddenly. And patients notice, there's as a cardiac floor, we get lots of patients kind of regularly. We call them frequent flyers, and they are oh, so and so's not here anymore, and they notice that. But all in all, is more dangerous for patients, because we're lacking the experienced nurses. The first strike, or the only strike we've had, it was the end of June. It was a Tuesday, I remember. It was a whole thing.
Y'all are out here taking care of all of us.
They were saying that if you didn't show up to work on that Tuesday, you wouldn't be eligible to work till July 1st, which was that Saturday or something like that. So it was going to be a good I don't know, like 5 days of without work, which some people genuinely like can't like afford that.
Right.
Which is like devastating to like some people. But it's like if you come into work, like you're breaking the like strike line or whatever, and like nobody was coming to work. Like I don't really know. I only know of like 2 nurses that came into work, like 2 staff nurses. One of them I just like heard that she did, and then another one I like spoke with her, and she was telling me like she had to go to work because she like just like wrecked her car or something like that, so she needed to pay the car payments, and so she couldn't afford to like not get paid. I'm pretty sure they like escorted in the like strike nurses and stuff like that. Like the when it went from staff to like the strike, they literally had the staff go out one entrance, like they escorted the staff out one entrance, and the strike nurses came in another entrance because they didn't want them to cross paths at all, which is like so dramatic. But she said like it was crazy because they had so many strike nurses. They were getting paid like $10,000 to work like 4 or 5 shifts.
Wow. Which is far more than the nurses who would be there. Yeah.
For, I don't know, a couple $100 a day. I don't know.
Wow.
I mean, she was working and she wasn't getting paid $10,000.
Yeah.
And they had free food for all the strike nurses. They gave them like report sheets. They brought in extra security at the doors to keep staff nurses out, which is, that bothered me the most. There was so much patient care that like went missed and stuff like that, like coming back the days after the strike, because the hospital sent a lovely little email afterwards, and they were like, yeah, super successful. Like patients were saying like how great their care was. So many of the strike nurses were saying that they would love to pursue a career here, like really great. Nothing really came of the strike from like what I'm hearing. They're really negotiating pay and stuff because our pay is just not competitive at all in Austin. There's been talk of another strike, but they're just still planning on that because the hospital's not like meeting, they're not bargaining in good faith as they promised. Yeah, we'll see. Sure, hopefully there's more change to come, because there's a lot of floors in the hospital that are just like very dangerous places for patients, and the pay is not competitive whatsoever.
We are out here on strike making sure that our kids are born safely, that we're taken care of when we are sick, that our neighbors in their most desperate moments get the care that they need. Rich, poor, black, white, or brown, native-born, or immigrant, everyone deserves care, and that's what this strike is about.
Here in Austin, the nurses at Ascension are striking this week to continue in their fight for a more equitable health care for all.